Hi everybody, Dr. Vince Gutierrez here, physical therapist. You can find me at movementthinker.org. Today is a progression of cervical retraction. This would be next step in order to create more movement. Once your body is used to that stress tolerance, that stretch tolerance that you've put on with just retraction without any force, just using your muscles to move back and forward, we're going to add a little bit of force. Anytime that you're adding force, it should be like a normal stretch. When you take it as far as it goes, you should feel a stretch. When you back off, your stretch should start going away. If there's any lingering symptoms or any pain, go see somebody who specializes in pain, somebody who specializes in movement, and they'll be able to guide you through as to whether or not this is normal or abnormal. We do not want to create symptoms that linger when doing this exercise. Discomfort is normal. Discomfort that goes away is definitely normal. If it doesn't go away, not what we want. Next, retraction, we've covered before, is simply sliding your ear backwards over your shoulder. It's not tipping up, it's not tipping down. When we look at this movement under x-ray, we actually see that the upper part of the neck moves through flexion when you do this, and the lower part of the neck moves through extension. What does that mean? Not much for you, but it allows your neck to get into a better position in order to move through its other postures, right? So for instance, if my head is forward and I try to rotate to my left, you can actually see instead of turning my nose to the side, my nose goes up to the ceiling and I end up here. Okay? And so getting your head into this retracted position, or shoulders over, ears over the shoulder, is what we look for when doing retraction plus other motions, and just other motions in general when they look at this under fluoroscopy or under an x-ray. So this motion is very important for you to be able to perform and maintain throughout your day. So for retraction, again, it's slide back. If you're looking at it from the front and you're looking at yourself in the mirror, you may see a double chin. Do not be self-conscious, and if you are, do it alone. Okay? Next, retraction from the side. You can come to the side. And what you'll see is that the earlobe will start to travel behind the middle of the shoulder. This is expected. Some people are so far forward head position that they've lost the ability to pull their chin backwards. That's okay for now. Bodies slowly adapt over the course of time. You've adapted to this position. You can start to unadapt to that position and create different motions. The next step for this is retraction plus overpressure. This is taught one of two different ways. One way is to place pressures on your chin and push yourself back. If there is any sort of jaw discomfort or jaw problem, I don't like to recommend people push on their jaw. This bone attaches to the jawbone. I'm kidding. So if you push on your chin, this is your jaw, right? This is the mandible. This is what moves up and down in that little joint up there by the ear. And so if there's any sort of TMJ problem or jaw pain, maybe not push directly onto your chin. One of the ways that I teach this in the clinic, you've got a couple. You can push on the bone here, directly underneath the eyes, and give yourself that push backwards. Or you can push directly underneath the nose and give yourself that push backwards. If there is no pain in the jaw and you want to push like this, this is the way it's typically taught and described in many courses and in many textbooks, is teeth together. Put your fingers on your chin and push. It gives you that slight downward tilt, which you're going to end up with that upper cervical flexion. You should feel a stretch when you're back here. What's critical about this is when you come out, that stretch should slowly start going away. If it doesn't start going away, pushing maybe a little too hard, too fast, too often, too frequent, too intense, too something. But the ideal is to improve mobility without increasing any symptoms. Thanks for watching.